So when we do your arthroscopy, you're laying on your back, and so your head is up this way and your feet are down this way.
Okay.
So that means the socket's kind of like that and the ball's like that.
Okay.
Because you're laying down. So here we are we come in looking from the side, and the bone to the left here with a curved surface, that's the femur.
Okay.
Covered with cartilage, and that's nice cartilage. It's white and slick, see?
Good.
This area is the socket, and we call that acetabulum.
Okay.
Then the labrum runs around the edge of the socket, and this is the labrum coming down like this. And here's an area where it's tearing and kind of coming loose from the edge of the socket. And right here, see how it's kind of red?
Oh, yeah.
That's inflamed from tearing and moving. Okay. Yeah, and here I am putting a blunt hook into the tear right there.
Okay.
So what we do is trim this back, and after we get it trimmed back, here it is here. Okay. And I think the edge of your socket was a little bit on the prominent side, so I just took a burr and smoothed that back a little bit there.
Okay.
Not much. It didn't require much work. Now the rest of your joint cartilage, this is socket, this is socket, acetabulum. Even though on the x-ray it looked like maybe you had some wear in there, the surface of the cartilage actually looks good. See how slick and white it is? That's good.
Cool.
And there was another area of tearing further back on the edge of the socket right here. That's the lateral labrum. See how it's separating away from the socket there?
Yeah,
I'm just kind of pulling it with the hook there. And then underneath that area, there was actually a bone spur. That's a bone spur right there on the edge of the socket. So I take a high-speed burr and I smooth it down to that.
That's the finish line.
Go from here to here. You can smooth it down.
Perfect.
Yeah. And this is just posterior acetabulum, just means the back part of your socket I'm showing there.
Is that a leaf?
That is normal. That's where the edge of the socket is there.
It looks like a leaf.
Actually, or it's more likely it's probably what we call the acetabular notch, which is this right here. It's just this depression in the lower part of the socket, that we all have.
Okay.
Where some vessels and a ligament comes in. And then that's the femur, that's all good. And then we did not always look in what we call the peripheral compartment. We kind of go down the hip a little bit and look up the femoral neck toward the socket.
Okay.
And that's just your femoral neck. And you did not need that worked on because your femoral shape was good on x-rays, and the angles that we measure to try to determine whether or not you maybe need that neck reshaped was actually normal. So we didn't have to mess with your femur.
Okay, cool.
Which is nice. So it was mainly torn labrum, a bone spur on the edge of your socket. Those were the biggest issues.